Hello everybody. Now in the continuing with our series for radiopathological correlation, we'll look at another case today. This is a 15-year-old boy which is referred for a routine IVP study in radiology department, and we don't have much history to corroborate, add on to anything in this case. So let us see the image and try and make the diagnosis. Now in front of you is a IVP image which is being taken after 15 minutes after dye injection. After when we give intravenous iodinated dye for IVP, we take serial films at 1 minute, 5 minutes, 10 minutes, 15 minutes. This is a 15 minutes film where the dye has excreted into the pelvic calyceal system, pelvis, and we can see the whole ureter on the right side, and you can see it entering into the bladder. Dye is there in the bladder, so we are able to see normal right side. So what is the striking finding on this IVP? We are not able to see the kidney on the left side. And there, when we see the renal fossa, we don't see any dye excretion, nothing, and not even in the renal fossa there is no renal dye excretion in the pelvis also. So I would say I am not able to see the kidney neither in its normal location nor in its any ectopic location. So because when you do not see dye in the renal fossa, you look for ectopic locations, we are not able to see anywhere. So I would describe this IVP as a non-visualized left kidney. Many reasons can be possible. Either the kidney is not there, or it is a grossly hydronephrotic non-functional kidney with paper thin cortex, or it may be cystic dysplastic kidney. So there are many causes possible for a non-visualized kidney on IVP. So in such a case, we usually will take, after doing this IVP, we usually would take this patient for ultrasound to confirm the cause for non-visualization. So when we did the ultrasound abdomen in this patient, I will show you one image of ultrasound. We can see multiple anechoic areas. Anechoic would be fluid, so there are multiple cystic areas in the renal fossa on the left side. Multiple non-communicating cysts which are, there is no obvious renal tissue evident. We are only able to see multiple non-communicating cysts in the renal fossa with no obvious renal tissue, and there was no function on IVP. So when we look at a multicystic like appearance like this with no discernible renal tissue and we do not see function on IVP, we would suspect a multicystic dysplastic renal kidney disease. And this is what my diagnosis would be from the images so far. Now I will invite Dr. Sanjeev to give his comments as a pathologist, what he is going to look for and what are his comments.
Yes, in such cases, if we look at a kidney, yes, this is one of the kidney. In such cases, if you look at a kidney here, what you are seeing as it was seen on ultrasound, definitely there are multiple cysts of variable sizes, and probably they were filled with fluid. Of course, now it is not seen here. And second and very important thing that we are seeing is there is no cortex or nor any medulla that I can see. So there is no renal parenchyma that is seen on gross as well, which was also correlating with the ultrasound image where you are seeing multiple cysts and no renal parenchyma, as Dr. Sumer was speaking about. Okay, if we take a histological examination, usually we would like to take it from the solid areas and see if there is any evidence of kidney tissue in this. Okay, so this was one of the microscopic examination that I am seeing here. So looking at this straight away, when I take it from kidney, basically I need to look at glomeruli. Do I see any glomeruli here? No, I am not seeing any glomeruli. And what am I seeing is this is one cyst. Of course, this is one smaller cyst that I am seeing. I am not taking it from a cystic area. This is a solid area, and what I am seeing is some small areas which are lined by some cells, cuboidal to columnar cells probably, and these are, and here also you can see here also and here. So these are some of the tubules which are not formed well, ill-formed tubules. And what am I seeing is probably this is a immature cartilage. There is a cartilage here which is not seen usually in kidney. Obviously it is not seen in kidney cartilage, and what I am seeing is some fibromuscular tissue surrounding this. So there is a disarray of the tissue. Normally we should not have any cartilage, we should not have cyst, we should have more of glomeruli here, and that is what, yes, very diagnostic of cystic dysplastic kidney or multicystic dysplastic kidney. wherein there will be haphazard arrangement of different tissues inside the kidney, no glomeruli, very less number of tubules, and of course there are definitely cysts. The pathogenesis for this is thought to be it is a developmental anomaly, usually occurs is reported because of obstruction at uretropelvic junction, or sometimes it is associated with uretral agenesis, and that is what probably, and this is one more correlation that we can find it is there is no, since there is no glomeruli and no tubule, that is why on IVP we are not able to find a functioning kidney on the corresponding side, and because obviously whatever dye has been given will not be filtered from this dysplastic kidney which doesn't have any glomeruli, probably no tubules or very ill formed tubules are there. Okay, so the final diagnosis for this will be a multicystic dysplastic kidney. Okay, this has to be differentiated from some other cystic diseases which can occur. One is a adult polycystic kidney which will have multiple cysts, however it will not have absent this one on radiological. Dr. Sumer will be speaking about it subsequently. In our further series we'll be talking about this. Okay, so this is about the multicystic dysplastic kidney.
Thank you, Dr. Sanjeev. And I'll summarize the take-home messages from this case. First, multicystic dysplastic kidney is a developmental origin disease. Usually you will see it unilateral. Rarely it can be bilateral, but usually it is unilateral. On ultrasound you will see multicystic soap bubble-like appearance. On IVP it will be a non-visualized kidney, and on pathology I'm sure you have heard him, there would be a varied array of tissue and no definite glomerular and tubular formation. I've learned a bit of pathology from him. Thank you very much, and we'll come back with more such cases in this series. Please stay logged on and keep looking for or subscribe to our channel on YouTube, DAMS Daily channel on YouTube, for more such cases. Thank you.